Donning and duping of PPE. First foremost, do the hand washing or hand hygiene. Donning a gown. Pick up the clean gown and allow it to unfold in the front of you without allowing it to touch any area soiled with body substances. Slide the arm and the hands through the sleeve. Fasten the tie and the neck to keep the gown in the place. Overlap the gown of the back as much as possible and fasten the waist ties or belt. Don a face mask. Locate the top edge of the mask. The mask as usually are arrow metal string along the edge. Hold the mask by top 2 string or loops. Place the upper edge of the mask over the bridge of the nose and tie the upper ties at the back, at the head of the or secure. Place the upper edge of the mask over the bridge of the nose and tie the upper ties at the back of the head or secure the loops under the ears. If glasses are worn, fit the upper edge of the mask under the glasses. Secure the lower edge of the mask under the chin and tie the lower ties of the nape of the neck. If the mask has the metal string, adjust this firmly over the bridge of the nose. Wear the mask only once. Do not wear any mask longer than the manufacturer recommendation or once becomes yet. Do not leave a used face mask hanging around the neck. Damp protective eyewear if not combined with the face mask. Don a clean disposable glove. There is no special technique it's required. If you are wearing gown, pull the gloves up to the cover of the cap of the gown. If you are not wearing a gown, pull the gloves up to the cover of the wrist. Personal protective equipment. Remove the gloves first since they are most soiled. If wearing a gown that is tied at the waist in the front, undo the ties before removing the gloves. Remove the first glove by grasping it palmar surface just below the cup, taking care to touch only gloves to gloves. Pull the first glove completely off by inventing roll the gloves inside out. Continue to hold the inverted. Remove glove by the fingers of the remaining gloved hand. Place the first 2 fingers of the bare hand inside the cup to the second glove. Pull the second glove on the fingers by turning inside out. Just pull to the first glove inside the second hand. Using the bare hand, continue to remove the gloves which are now inside out and dispose them in the surface container. Using the bare hand, continue to remove the gloves which are now inside out and dispose them in the refuse container. Perform the hand hygiene. Remove protective wire. Remove protective eyewear and dispose properly on the place in the appropriate receptacle of cleaning. Remove the gown when preparing to leave the room. Unless the gown is grossly soiled with body substance, no special precautions are needed to remove it. Avoid touching soiled part of the outside of the gown if possible. Roll up the gown with the soiled part inside the discard in the appropriate container. Remove the mask. If using mask with string, first untie the lower string of the mask, untie the top string, and while holding the ties, securely remove the mask from the face. Or if side loops are presented, lift side loops up the way of the ears and face. Discard disposable mask in the waste container. Perform proper hygiene.